But so far, we've met this objective throughout. And I want to thank all those involved for their part in this national effort. On the most recent figures, 313,769 people have now been tested for coronavirus. Of these, 98,476 people have tested positive. The number of patients in hospital with symptoms is now 19,529. 12,868 people have sadly died, an increase of 761. This all just goes to show why we cannot let up in our efforts. We cannot let go of the hard work that's been done so far. This shared sacrifice, and I know it's a sacrifice, is starting to work. But we will not lift these measures until it is safe to do so. Everyone who stays at home is doing their bit, protecting the NHS and saving lives. But while everyone else stays at home to save lives, our health and care workers go out to work to save lives. And today I want to focus on social care. I want to set out the next steps in our action plan for social care that we're publishing today. From the moment of the emergence of coronavirus, we've known that some of the most vulnerable to this disease are in social care, and we've been taking action right from the start. We first set out guidance back in February, and today I can tell you what further steps we're now able to make. Our goal throughout has been to protect residents and to support our 1.5 million colleagues who work in social care. We've injected an extra £1.6 billion, and as the Chancellor said, we will do whatever it takes. This is our plan. First and foremost, from the start, we've focused on the need to control the spread of infection in social care settings. Today, we've strengthened the rules so that all care home residents who are discharged from hospital will be tested before being admitted into their care home. We'll test all symptomatic care home residents, and as I announced last Friday, we've introduced testing for all social care colleagues and members of their households who need a test. At the same time, we're increasing again PPE supplies to social care. We're creating a supply, logistics and distribution network of unprecedented scale. Building on the PPE plan I set out on Friday, over the next 3 weeks, we'll continue priority drops to the local resilience forums who distribute to the social care system according to local need, while we roll out our new online delivery system for social care settings. This will be integrated with the NHS supply chain central PPE logistical operations, with kit shipped directly to social care providers via the Royal Mail. All of this will contribute to slowing the spread of coronavirus within care homes. I want also to enhance support for our social care workforce. One of the things that I'm most proud of during this terrible crisis is that people have held health and social care workers in such high esteem across the board. It's not clap for the NHS, it's clap for our carers. And to take this further, we're today introducing a single brand for social care to symbolise the entire care profession. This is something I know so many people in the profession have called for. This badge will be a badge of honour in a very real sense, allowing social care staff proudly and publicly to identify themselves, just like NHS staff do with that famous blue and white logo. I know that many businesses will want to offer the same recognition and benefits as they do wonderfully to the NHS. We've asked the supermarkets to confirm that social care workers can have the same priority access, and I know that the public value your work in care as much as I do. I also know that we need more people to return to social care or choose to serve for the first time. To make that happen, we're strengthening our national recruitment campaign with the aim of recruiting tens of thousands more people into social care. And we will pay for the initial induction training. This is a job where you have the chance to make a difference to people's lives every single day that you go to work. And I've seen, as I'm sure we've all seen, the amazing efforts of good social care. I've seen it with elderly members of my own family. I've seen the tenderness and the dedication with which people in social care support our loved ones at their time of greatest need. Everyone knows the job isn't easy, whether supporting people of working age, who are some of the most vulnerable in society, or supporting people and their families with dignity at the end of their lives. But I know what a fulfilling profession it is, and I know that many will answer our call. There's one other thing and one other change I want to make, which is giving people the right to say goodbye. One of the important things that care homes do is support people at the end of their life. Sadly, even in normal times, each month, about 10,000 people die in care homes. And our social care colleagues work incredibly hard to ensure support for people and dignity to people at the end of their lives. Wanting to be with someone you love at the end of their life is one of the deepest human instincts, and it's a moment that will be with you forever. Done right, it can help those left behind to cope, and it brings comfort to those who are dying. Coronavirus, of course, has made this much more difficult, and I've been really moved and upset by some of the heartbreaking stories of people dying without a loved one nearby. As a father of a 13-year-old myself, the reports of Ishmael dying, aged 13, without a parent at his bedside, made me weep. And the sight of his coffin being lowered into a grave without a member of his family present was too awful. So I'm pleased to say that working with Public Health England, the care sector and many others, we're introducing new procedures so we can limit the risk of infection while wherever possible giving people's closest loved ones the chance to say goodbye. And we're making crystal clear that it is unacceptable for advanced care plans, including do not attempt to resuscitate orders, to be applied in a blanket fashion to any group of people. This must always be a personalised process, as it always has been. I want to end by addressing carers directly. As much as the doctors, the nurses, the paramedics, you are on the front line in this battle. I want to thank you for your courage and your commitment, for doing paid or unpaid, formal or informal, the work that you do, difficult, demanding, vitally necessary, and you do it with such love and care and attention. Taking on the extra shifts that might be needed to fill the gaps left by self-isolating colleagues, juggling your own caring responsibilities very often, providing dignity and comfort to people in some of the most difficult circumstances. We as a nation stand with you. And I say to everyone watching, you can stand with our carers too, by staying at home to protect the NHS and protect social care and save lives. With that, I want to pass to Angela to set out the most recent information about the progress of the disease.
Thank you. The information we wanted to start with today is evidence about how people really are staying at home. So what's shown here is, roughly speaking, for the last month, so from the 19th of March to the 14th of April, how much use there's been of different kinds of travel compared to how it was in February. And what you see is that for all the different coloured lines, that's now down to less than a third of what it was back in February, and that for the Tube and National Rail, it's particularly low. So this is real hard data to show that all of us have done what we were asked and stayed home. If I could have the next slide, please. What we see is part of the evidence about how that is working. So this is new UK cases. In blue is people diagnosed in hospital, and in orange is people whose diagnosis has been outside hospital in the second new pillar of commercial swabbing activity. But really and the time goes from 21st of March to the 15th of April. And what I see that encourages me when I look at that slide is 2 weeks now of definitely not increasing anymore. I see a flattened curve. And for me, that is evidence that what everybody has done together has worked for us all. If I could have the next slide, please. That's further reflected in these data about people in hospital beds with COVID-19. Across the country, that fell by 1% yesterday, and in Greater London, it fell by 5%. So once again, what I see here is evidence that everybody's efforts to stay home and not have as much contact with other people as would be normal is having the impact that we hoped it would have, and bringing this epidemic to a much better trajectory where this is currently flat and no longer rising. Final slide, please. The final slide is comparing the sad deaths that we've had in our country with those in other countries. These curves are all lined up, so they all start on the day at which each of those countries first had 50 deaths. And you can see the line in dark blue in the middle there is the United Kingdom's trajectory, still climbing. We'd always expected that to still be climbing, even though the number of new cases is starting to flatten off. And that's because these are very lagged data, because, of course, sadly, it takes a while for people, first of all, to succumb to this disease, and then, secondly, for those cases to be reported. The United Kingdom data there are from Public Health England and from our devolved administrations, and we're watching and hoping that those two will soon start to follow a flatter trajectory. And with that, I think I will stop with today's data.
Thanks very much. If we go to questions from the media, the first question is from the BBC and HUPIM.
Thank you very much. Secretary of State, you're now offering testing to social care staff and care home residents where appropriate. But how's that going to be achieved, given the pressures on capacity and your existing promises to NHS staff? And when exactly will it be delivered?
Thanks, Hugh. Well, I'm very glad to say that we now are testing regularly NHS staff across the board. And we rolled that out from last weekend. And we have started also testing social care staff. 4,100 social care staff have already been referred for tests. And as our testing capacity increases, so this means that more and more people can be tested. And in fact, we have, as some people have reported, over the Easter weekend, we had some spare capacity because the number of people coming forward for testing was not as high over the Easter weekend, which means that we can now expand testing not only to staff in social care, but also within social care settings. The previous rule had been that once 5 people in a social care setting had tested positive, then others with symptoms were deemed to have coronavirus because it was highly likely to be coronavirus. We will now ensure that everybody who has symptoms gets tested, and the critical other change is that those leaving hospital will now be tested, and they will be put into isolation until those test results come through, and if the test results come through positive, then they'll be held in isolation to make sure that they protect those currently in the care home. So this is a positive step, all about strengthening the tools that we have to reduce the spread of coronavirus within care settings and to support the care sector staff that I've spoken about that are doing so much to look after some of the most vulnerable.
Can I come back quickly?
Of course.
Given you're making quite slow progress to your 100,000 a day target by the end of this month, how are you actually going to cover this large number of social care staff and NHS staff and hospital patients? How is it going to be achieved?
Well, as I say, Hugh, we're building capacity of testing all the time. And the reason that the figures on the number of tests done have been flat over the last couple of days has been because of not enough demand rather than not enough capacity. And that gives us the space to be able to increase the number of people eligible for testing. So now we have testing available right across the NHS and social care for all those who need it. And I'm very pleased we've been able to expand capacity so that that can happen. And as we build capacity further over this month and then beyond to that 100,000 a day target by the end of this month, we'll expand further those who are eligible for tests, all as part of the plan to get a hold of this virus and to make sure that we support the key public services that we need at this moment. Thanks very much. Robert Peston from ITV.
Afternoon to all of you. A couple of very quick questions, I think, for all of you. The data seems to indicate that we are either at or past the peak of this phase of the epidemic. Now, in countries where that is so, Spain, Germany, Italy, Austria, Denmark, they are all already talking about how and when they will ease the lockdown. What is it about the British people that means you can't trust them, you feel, to continue to isolate? If you just talk a bit about what the process of easing these restrictions will be. And secondly, those who work in social care homes and settings have been saying for weeks that they are not getting enough help and guidance from you about how to isolate those who are showing COVID-19 symptoms. They're deeply worried about infection to other vulnerable people in those homes. Is there more you can do to extract those people with these symptoms and put them in safer settings?
Well, part of the plan that we've set out on that second question is precisely about more isolation, and maybe Chris can say a bit more about this, and I know that Chris will want to comment on the point about the peak, because you're right that the clear message is that it is too early to make changes, and therefore the message to the public watching is that everybody can play their part by staying at home, which protects the NHS and saves lives. And that message is very clear and very straightforward. Of course, I understand there's a broad discussion about what next, but we're very, very clear about the thing that people need to do now. Chris?
So on the issue of the peak, our view is that it's probably reaching the peak overall, and that's what the flattening shows. I think it's important, and I'm saying this because new data will come out presumably tomorrow. My expectation would be that the number of deaths may well go up because there has been after every weekend, we see a dip over the weekend and for the 2 days afterwards, and then an increase as we catch up with the numbers. And after a long four-day weekend, there may well be a bounce up tomorrow. So I think it's very important we don't get to the point where we say, look at the numbers of deaths, that means we've passed the peak. But we do all think that this is flattened out. Sadly, we do think that high numbers of deaths will continue for certainly a short while on from where we are at the moment. I think there's an additional reason that we are, so I think at the moment we are not yet at the point where we can say confidently and safely, this is now past the peak and we can start thinking very much about the next phases. I think the additional technical point I'd make, and there are others I can make as well, is that at this point in time, we do not know where the force of transmission is between about 0.5 and about 1. It's in that range. The more we have an understanding of where that is, which will happen as we go over the next 10 days or so, the more easy it is for us to judge exactly how we can go through to the next phase in a way that's properly evidence-based. So there are technical reasons as well as peaking reasons for being cautious at this point.
Angela, did you want to add anything?
Just to reiterate what Chris just said, that what we really need is to observe what happens with new cases as they arrive in hospital in order to make estimates about how much impact all this very hard work that people have done has had, because that's absolutely crucial for us to understand properly what changes, if any, might be possible.
Robert, do you want to? Did you want to
Well,
come
yes,
back on
a
that?
couple of points. I mean, one is I didn't hear from you any practical proposals for how to help care homes isolate, quarantine their vulnerable, or those who are suffering, to protect other vulnerable members of those homes, because we've all seen large numbers of deaths within single homes that, you know, some of those families would have thought could have been avoided if there'd been better quarantine around those who fall sick. And secondly, I think the bit that many people don't understand, I don't think they're saying you've got to essentially name a date for when these restrictions on our civil liberties will be eased, but I think they would expect a grown-up discussion about what that phasing of the restrictions would look like, and that simply hasn't been forthcoming from the government, and it is forthcoming from other governments.
Well, it may be, but different countries are in different stages in this epidemic. And one of the things that I think we've learned during this crisis is that the clarity of the guidance to the public is incredibly important. And hence, we repeat it. And it's increasingly understood and strongly supported. So that is... That's good. On the other point on care homes, of course, there's detailed guidance and there's further guidance in the action plan that we're publishing today. Of course, amongst the 25,000 different care settings, approximately 3/5 of which are care and nursing homes, there are very different circumstances in terms of how isolation is best done. In some cases, particularly in the larger settings, it's possible to have isolation within the home. In other cases, it'll be necessary to isolate by having a resident stay elsewhere. But there's detail in the guidance, and then there's an awful lot of work that goes on at a local level with the directors of adult social care to make sure that we get those details, that isolation done as well as is possible in these incredibly varied settings across the country. I don't know if you want to add on that.
Well, I think to reinforce the point that actually there's much more variety between different care and nursing home settings than there is between different hospitals. So advice does have to be tailored very much to the specific setting. And on your wider point, what we have tried to do is lay out very clearly some of the trade-offs that will have to be made just on the health side between different, for example, forms of mortality, the direct ones from COVID, the impact immediately on the NHS emergency services, the longer term, medium to longer term impact of having to reorient the NHS towards COVID over the medium term, and the long term impact of socioeconomic factors on health. And these do not always end up with exactly the same answer. And what we're going to have to do in bringing together the right solution is to try and make sure, based on information that we will get more of over the next while, including a better understanding of the R, probably some serology data to understand what proportion of the population has had this. That's an additional bit of information that will really help us, in a sense, to balance these different, very important impacts on health over the next phase.
Thanks very much. Thanks, Robert. Alex Thompson at Channel 4.
Good afternoon, everybody. And a response from all three of you would be good if you can. I'm sure you'll all accept what is obvious. You've all been late, very late, in dealing with the crucial issues of care home staff and care home residents. Was that because, frankly, you wanted to prioritise the lives of younger people in hospitals at the NHS sharp end? And have people simply died in British care homes unnecessarily?
No, Alex, neither of those things is the case, and very obviously not. The truth is that, as I said in my opening comments, that we first put out guidance to social care in February, and we've repeatedly updated that guidance according to the circumstances, according to the progress of the disease, the increasing prevalence of the disease in the community, and in terms of the support that's been available. And what we've been able to do today is update that guidance and improve some of the policies to make sure to respond to the conditions that prevail today. So that's why we've put out the action plan now. It builds on the work that we've been doing, as I said, since the very first moment that we understood coronavirus. One of the first things we understood about this disease is that it has a disproportionate impact on older people in our very first conversations about it. And therefore it was clear that especially for care settings supporting older people, and it's also true for care settings that support people of working age, we were going to have a particular focus, and we've had that focus throughout. I don't know, Angela, do you want to add anything, or Chris?
I suppose what I would like to add is, looking forward, what are the really burning questions? Obviously, the questions we talked about already today, about what to do inside care homes. And then I guess also there's a huge question which we haven't focused on quite so much, which is how to protect the care homes that don't yet have cases, and try everything we can to keep it that way.
Thanks very much. Nick Martin from Sky.
Very good afternoon. A question to all of you, I suppose, but to the Secretary of State first. Secretary of State, it was Sunday rather, when I broached the subject of tests in care homes with you following a report the night before. And I have spent several days now in care homes, and I can tell that there is now some optimism with some of what you've said about tests. But there are a few issues that I've been hearing time and time again, and I've spent another sobering day in a nursing home today. And one of the issues which has been cropping up is there seems to be, nurses are telling me, not just in this home, but in other homes, that they're getting some pushback when it comes to trying to send elderly residents into hospital for treatment. And at the other end of the scale, there seems to be, and we have evidence to show this, that there seems to be an eagerness to discharge elderly from hospitals. One care home was told it was policy to clear beds. It looks like the elderly are being cleared out of hospitals. Is that policy?
Well, firstly, I pay tribute to the work that you've done, Nick, and I think that your reports have been excellent. I think that it's helped to shine a light on an area that often doesn't get as much attention certainly as the NHS, and so I'm grateful to you for that. I'm glad that you report from optimism from some of the steps that we've been able to take today as testing capacity goes up, for instance, to focus those extra tests on care homes and care settings. That's positive. I'll ask the Chief Medical Officer to respond on one of the points that you make. The point I would make is that the decision to admit somebody into hospital must be a clinical decision based on individual circumstances, not a blanket rule. And on the discharge, of course, the best place for people who clinically are able to be discharged is to get them home. So of course there's a policy that when people are clinically ready for discharge, that they should be discharged. I mean, that's the nature of hospitals. That's true all of the time. But it's got to be made on that individual clinical diagnosis of what's best for that individual patient.
No, just to reiterate what the Secretary of State said, I mean, working in hospitals, what you're aware of is that hospitals are very good for certain things, and people need to come into hospital for medical or nursing care under specific circumstances. But once that need is no longer there, people should absolutely be aiming to be discharged to the right place for them to stay. Staying in hospital is neither, for most people, a particularly pleasant experience, and it is also an area where you are actually more likely to catch infections and other issues than you are in any other setting. And it is sensible for older and indeed all patients to keep hospital stays as short as is medically or from a nursing point of view sensible. Clearly not to be in a situation where people have to leave hospital before that stage, but once that point has been reached, it really does make sense from every point of view that people that are then discharged back to their normal place of residence.
Is that, are you happy, or is it another question?
Yes, I do have a follow-up. With regards to tests,
yeah.
Can you just be specific, Secretary of State, about numbers? There are 1.6 million people working in social care. all doing a very difficult job, potentially all needing tests. How many tests have you put aside for social care? And what is the time scale that you promise to deliver them in? And just one more question with regards to funding. You will know there was a crisis in social care before coronavirus came along. And just a few weeks ago, the Chancellor announced £1.6 billion to help communities get through it. Now, social care providers are telling me across the country that they are coming up against a brick wall from their local authorities who are not releasing the funds. What do you say to councils who have been given money to help things like social care, but have so far not handed it over?
Well, we have funded councils in order to be able to support the front line, and that's where the money needs to get. It's something that we watch very closely, and I work with the Community Secretary on making sure that that happens. Councils, of course, themselves are doing an incredible amount of hard work in responding to this crisis, both in terms of their responsibilities for social care and right across the board. So I support councils in this difficult time, but we do need to get the money that is there for social care to the front line. There is and then on the other point that you raise, I just think that on testing, we currently do have capacity to increase. As I say, there have been 4,100 social care staff referred for tests so far. The CQC have been doing brilliant work at finding where the tests are most needed and making sure that people are actively referred. And we're setting out a process with the LGA and the directors of adult social care and the CQC how that should work. At the moment, we have spare capacity in the thousands, and the capacity is ramping up to, as I say, 100,000 a day by the end of the month. The vast majority of that increase will be for the NHS and social care as a whole as the testing capacity ramps up. Martin Baggett from the Daily Mirror.
Good afternoon. The action plan refers to everyone in social care being offered a test who need one. Could you expand upon this criteria? Does it mean any care home resident or carer who asks for a test will get one, or is it only for symptomatic staff? And could you outline the time frame when this will be delivered, or is it immediate?
It's immediately. The policy change comes in today with the publication of the document. For residents, for staff, the process of getting staff their tests in social care started when we changed that policy on Friday. As I say, there's over 4,000 who've already been referred to a test. The definition of who needs it is, in the first instance, those who are symptomatic or a member of their household if they're under household isolation because a member of their household is symptomatic, because it is primarily for staff to ensure that staff can get back to work if they are off. And of course, if they are symptomatic and at work, then they should be at home because they should be self-isolating. And as the capacity expands, so we'll be able to expand that definition of need. Laura Hughes from the FT. Oh, I've just been informed that Laura is not able to join us. So we've got Jessica Frank-Keys from the EDP.
Good afternoon.
I think so, yeah.
Secretary of State, when the time comes to lift restrictions on businesses and people's lives, will the end to lockdown be rolled out across the country as a whole at the same time? Or given that many areas of the UK, including Norfolk and the east of England, are some weeks behind the capital in approaching the peak of the virus, will those decisions be taken on an individual regional basis? Also have a question for the Chief Medical Officer. We've heard about some elderly people in a Norfolk care home, some of whom are living with dementia, being confined to their rooms for up to 3 weeks. Can you offer any clarity on whether the government's advice on people exercising outside also applies to care home residents? And whether, while following procedures around shielding the vulnerable, homes should be ensuring residents are able to spend time outside of their rooms and outside getting fresh air?
Well, thank you, Jessica. I'm going to ask Angela to answer the first question and Chris to answer the second. But just before I do, I'm so glad that you're on, because one of the things I'm missing most about in this lockdown is getting to Suffolk, where the Eastern Daily Press covers my constituency as well. And it was wonderful to see on the front page of the newspapers this week a baby from Brandon in Suffolk, in my constituency, who recovered at the West Suffolk Hospital. And is now home and safe and well, which I know was well covered in the Eastern Daily Press as well. Angela, if you could answer the first question.
Is it possible to go back to the slides and look? Is that helpful? If we could go back to the ones called people in hospital beds. I think you ask an absolutely terrific question there, actually. So, no, not possible? No, okay. So, what we would expect to happen is that the peak would be at the same time across the country. And that's because, of course, the way we changed our behaviour in the country was largely speaking the same everywhere. So whilst we've always said London is 2 weeks ahead, what we meant was really London was 2 weeks ahead on the way up. In terms of starting first to flatten and then to go down, what we'd really expect is everywhere to be the same. That's not really exactly what we're seeing, in that London is, the number of people in hospital beds in London, for example, fell by 5% in London yesterday, but across the country it was 1%. So I can tell you that we've had quite long discussions about that in various fora. We decided that there's so much variation that we don't have a clear answer for the differences yet, and that it's quite possible that actually we are seeing what we would expect, which is that the flattening off is pretty similar in different places, and that maybe one of the reasons that London seems to be that the people in hospital beds in London seems to be falling faster is that perhaps in London, because cases rose faster here, people responded to all the earlier bits of advice about staying away a little bit faster. That's the advice before the 23rd of March, when everyone was told please to stay home.
Thanks, Jessica. Chris?
Well, I think it's important to understand that there are two things, in a sense, which are potentially in tension with one another. I wouldn't want to comment on individual cases at all, but in general. On the first thing, which is very clear, there is no situation, there is no age, there is no condition where exercise is not a good thing. So anything that can be done to encourage people and allow people to take exercise is clearly a good thing. Now, that might mean, in this period when people are locked down, exercise indoors, and there's lots of things people can do in their rooms, can do in their houses. Nevertheless, one of the reasons that we had exercise as one of the very limited range of reasons people could leave their houses and still be protecting the NHS and saving lives was for exercise, and it was for this reason. Exercise is one of the best things you can possibly do. On the other hand, there are a small but important number of citizens who are either much older or have other health conditions where shielding, where what we try to do is prevent a situation where they come into contact with someone who could pass on this virus, is a very important thing to do for them. And that's because these people are highly vulnerable, if they get an infection, to actually that going on to be a severe infection, and in some cases, sadly, going on to die. A much higher proportion of very old, of older citizens or people with significant health conditions are in that situation. And of course, if you've got someone who is both shielding but also needs exercise, there is a bit of a tension between those. And I think in those situations, we would want people to exercise indoors, but definitely would want them to exercise. And then the final reason why it may be sensible for some individuals to be in their rooms is for an infection control reason, and that was something the Secretary of State talked about earlier. If someone is suspected they might be at risk of having the coronavirus, then we say we want them to stay in their rooms to protect other people in their nursing home, in their residential home, in their shared home. So those are, people who are care home staff and people indeed who are living with more vulnerable people have to be aware of these different areas, but I certainly want to stress the point you're making that wherever possible, people should be taking exercise. This is very important for long-term health.
Thanks very much, Jessica. We can go back to Laura Hughes now at the FT. Hi, Laura.
Right. The government pledged that there would be 25,000 tests being carried out by the middle of March. We're now on April the 15th and we haven't reached that target. So why should the public believe that you can achieve 100,000 tests a day by the end of April? And secondly, Northern Ireland has just announced they are extending their lockdown for another 3 weeks. Can we expect the whole of the UK to move at the same pace?
On the first one, I'm afraid that the premise of the question is wrong. We committed to 10,000 tests by the end of March, which we hit. Then we had previously committed to 25,000 by the end of April. I increased that goal to 100,000. So we have hit each of the goals that we've set on testing. And as I say, we've had capacity continuing to ramp up this month. The demand has been lower over the Easter weekend as staff haven't wanted to come forward for testing, which is understandable during a long weekend. But the goal is still clear to reach 100,000 by the end of this month, and we publish all of that data, of course. On the second point, this is very much a matter for the decisions that we're going to take at Cobra tomorrow as the UK. I think that it's probably best to leave it at that and say we'll wait until the formal decision is taken tomorrow. Thanks very much. Isabel Hardman at The Spectator.
Thank you. A question firstly to the Health Secretary on another issue that has a huge impact on your brief, which is domestic abuse. Now, I know the government has set out some help for victims of domestic abuse and more money for a helpline and an awareness campaign, but the frontline charities that I've spoken to say they're experiencing such a big demand, a big increase in demand, and such a dramatic fall in funding. They don't see not only how they can help victims right now, but more worryingly, after the lockdown, once women are better able to escape and children go back to school and start telling their teachers what has been happening at home. So do you have a post-lockdown support plan in place for the predicted surge in domestic violence that's going to go way above what we're seeing already in the coming months? And a second question to the Chief Medical Officer, what impact are you expecting on the NHS of this rise in abuse, not just in terms of physical injuries, but also in terms of the complex mental health problems that a lot of survivors have for many years after leaving these relationships?
Well, this is such an important question, Isabel, and I know that the Home Secretary set out a package of measures and of support to those brilliant charities who help people who are subject to domestic abuse at the weekend. And of course, we're open to expanding that, and in particular, looking at this point that you raise about what happens afterwards and making sure that if there is an increase in revealed cases that are currently hidden because the lockdown is ongoing, that we make sure that we give the right level of support to all those who come forward. You know, there are many costs to this terrible epidemic, and this sadly is one of them. And I talked to the Home Secretary about it. I think the package that she brought forward was very strong, but there's clearly we need to do the work that's necessary to support everybody on this, and as much as is possible given the nature of the lockdown and the impact that it has. Chris, you were asked specifically.
Yeah, and it's clearly not possible to be sure exactly what the implications of this will be in terms of domestic abuse over time, and I think anybody who claims to know that is probably unlikely to have data to back it up. But it is, at any time, domestic abuse is a very major, both mental and physical issue, as well as all the huge social ramifications that come out of it. And dealing with victims of abuse, of whatever sort, to be clear, because abuse can take very many forms, has to take account of those very complicated interactions of mental distress, ill health, in some cases post-traumatic stress and things that go with that, and then in some cases, not all, physical impacts ranging from relatively small to really quite profound. So this is a very serious issue, and it always needs a multidisciplinary approach to dealing with it properly.
Is there anything you want to add, Angela? Yeah. Another, you've got a follow-up?
Yes. Yeah. I just wondered if you could explain how the package that the Home Secretary has set out is strong, when there was nothing for accommodation for victims who are fleeing. Obviously, you'd rather that they were able to stay in their homes and the perpetrators were supposed to move out, but that isn't always possible, particularly given they need to get away to somewhere where the perpetrator doesn't know where they are. And given that before this lockdown, refugees were having to turn away around 90 women and the same number of children on an average night, there's clearly a need for a huge package of funding over the next few months, which there's been no mention of at all so far.
Well, I think the most important thing in the first instance is especially during a lockdown, as far as I understand it, is to make sure that we give channels of communication for people who aren't able to cry for help because the sorts of places like at school where you might be able to get out of your home and be able to have the confidence to come forward, to make sure that there are alternatives provision for that. I think that was the urgent thing that needed doing. And of course, when it comes to supporting refugees, we are, and all of the supporting infrastructure, we're of course willing to look at that and make sure that it's as strong as it possibly can be. Thank you very much. That concludes today's Downing Street coronavirus briefing. Thank you, and we'll see you again, no doubt, at the same time tomorrow.